a very good evening to everyone who's here, and I think appreciative of the patience of of everybody who's been here. I think for the past 2 hours and listening to the sessions that are going through. So I think we have gone through various micro topics in the area of tobacco and its relation to several areas from our previous speakers, which are very enlightening for all of us. And I would like to specifically focus today in the area of, let's say, tobacco and development. Okay. So when we say tobacco and development, let's first see what we mean by the term development, because it's a very general term and it can mean a lot of things to different people, right? So our general understanding of development when we speak in a public context is primarily about economic development, right? So when we talk about national development or the development of the country, we are predominantly talking about economic development, the growth of the country. Okay? But it's also important in a context like it's a multi-pronged concept, like issues related to tobacco. We need to have a slightly broadened view of what development means, because apart from economic development, which is definitely impaired by this epidemic of, let's say, tobacco use and in our country, other areas, major areas which I would like to touch upon as we are discussing this topic is that major impacts that it has on health, right? Many of our speakers today have covered about the impacts of tobacco on health, on mental health, right? How tobacco use and availability and control can actually impact human development. So let's say human beings as a generation, when a new child gets into the world, how does availability of tobacco or use of tobacco by the parents, how does it impact even early development for children? So that's another area which is important for long-term sustained eradication of tobacco misuse in the country. Then how does tobacco impact human rights, right? How does it impair the rights of certain groups of people? And various other non-economic domains which are also impacted due to tobacco. So we look at some of these briefly. Many of these have been covered by our previous speakers, so I'd probably touch upon their points, which has been very helpful to have been covered before my talk today. Right. Okay. So to get a more holistic understanding of where this is coming from, right? So we're talking about tobacco use in India, and to understand that this is an epidemic, not just in India, but globally in various countries. The advantage that we have here is we already have certain norms, certain laws, and we're trying to lobby for more laws, more stringent laws that can, strengthen our systems, health system, public systems to help people come out of addiction and restrict people getting into more addictions related to tobacco. So globally, if we see in the context of that, because it's a global epidemic, right? WHO, which is the Global Health Organization, the World Health Organization, has come up with Sustainable Development Goals. And one of our previous speakers also spoke about the SDGs that we have. Now, what are these Sustainable Development Goals? So these are goals that are targets, that are specific targets for all the member nations, India being one of them, right? For us to achieve by 2030, so 2030, we've got another 7 years to achieve these things. And there are goals in various domains, just like, let's say, for education, for infrastructural development, employment, health, right? All of these areas, there are specific goals. And as it was, although I work, like I said, I work in the area of addiction medicine, we work more on interventions with people. Specifically, when the organization invited me for this talk, I thought it's important that we look at what's there in the background, what is informing all these decisions that we are making, which means there's a lot of work that people have done in the background, literature searches and literature interviews that people have done in the background. And that brought about some information about, that tobacco use is something which is so ingrained in our communities as against other drug uses. Tobacco is so commonplace, it's so commonly available. Just like how you get tea, coffee off the shops, you can also get certain tobacco products easily, right? So it plays a major role in impacting right? It contributes a lot. Let's say almost 30%, 1/3 of the non-communicable diseases goals that we have from Sustainable Development Goals are directly related to tobacco use, to say. So I would like to focus today on certain aspects that I noticed, which is widespread in our community of late. And so the first thing to see is we are all aware that there are major health risks of tobacco use, that it affects every single organ of our body, right? If we go into any PHC in the country, primary health center in the country, we will see that there are a lot of government-sponsored posters about the ill effects of tobacco, and this is also for public awareness. So these are some of the goals which have already been, let's say, we have been working somewhere on this line, based on even the previous developmental goals, the MDGs, the Millennium Development Goals that we had, also had some goals for tobacco. So we have made some baby steps there. We have to, but I think with a short span of time that we have to achieve a lot of things, it's important that we take more bigger leaps in these areas. Okay. So to summarize a few points that our previous speakers spoke about, one is about how tobacco impacts, development is one about how does it affect agriculture in terms of occupying vast areas of cultivable land, which goes of tobacco use, and then that is not available for us to achieve our very basic food needs, right? The second thing which we speakers also spoke about earlier was that how, because of the human resource that is needed for this cultivation in all of these lands, now major part of our productive age group people, and especially women and youth, right? Even in a lot of places, it's also children who are not legally supposed to be employed, are employed in these labors in the lands for employment, and that is a more morbid thing than to say mortality. So while we talk about the impact of tobacco on development, the very obvious, of course, the more risky impact that we see is that it can lead to death. So that's lethal, that's the end of a life. But yes, that is, let's say 10 to 15, 12 to 12% of people who actively die every year because of tobacco related complications. The larger epidemic, the reason it's been called an epidemic, right, is that because without our obvious knowledge or notice, it has been slowly ingraining into a lot of morbidity that is developing in the community. So without even our knowledge, like we said, a lot of youth are experimenting with it. A lot of youngsters are trying to use it for, let's say, experimentation for pleasure and all of it. What happens with constant use? Of course, there's a lot of biological things that happen, and I think it's beyond the purview of our discussion today. But there are a lot of things that happen in the body, and our capacities get limited because of constant or regular substance use, including tobacco use. So let's say somebody, as a country, if we are capable of 100% of things, with a large section of the productive age group being engaged in these things, it comes down by, let's say, 10, 20%. And that can lead to a deficit in terms of our capacity to achieve goals as a country, right? Okay. So in the context of, like I said, in the context of SDGs, I would like to highlight a few goals which are there, and let's see how tobacco use per se is impacting this. So one of the goals which is there in the Sustainable Development Goals is ending poverty in all its form everywhere. So it's for every country to end poverty in their countries. Now we can, it's a very obvious understanding here that, because a lot of resources, individual family resources, are getting diverted to expenditure on procuring these products, on buying tobacco products, that leads to lack of resources to fulfill their very basic needs, right? They don't spend it on, let's say, a child is sick, there is no money to go to the hospital, but there is enough money to buy cigarettes or procure substances on a daily basis, right? So, and because we also saw this in our previous talk, that it is not about the individual's choice that I will use the substance. That is probably the initial 1 or 2 times when they decide as a conscious choice, okay, let me experiment with this substance. Once it sets in as an addiction, it is an illness. So unless it is treated, it is very difficult for the person to come out of it just with, let's say, internal motivation to quit and to say that, okay, I will not spend on it. So it also puts a lot of pressure on the health system to provide for healthcare needs for all of these people who are going through this addiction as a pandemic. So let's say if there are 2 patients who come with cancer-related complications and there are health professionals who are focusing on it, there are going to be 10 people who come with addiction or substance use-related complications, and we sadly do not have so much human resource in the health sector to focus on it, and that is creating some complications, right? So what does that mean? It means that we will have to probably put some restrictions right in the beginning where they're able to procure it, where they're able to utilize all these substances. So that's one aspect. Second thing is about how does it impact the younger generations who are coming up, younger children who are, let's say, right now being born and growing up in our communities. Because, like we said, the manpower, the human resource that's coming in, it can curb education for children, like especially in the rural areas where we are seeing from reports of the national surveys that children are being involved in the farms, right, to cultivate some of these things, some of these tobacco products. In BD rolling, tobacco rolling industries, younger population are being involved. That way, their quality of, let's say, skills are impaired, right? And that way, we already spoken about how, because of lack of cultivation, it does not allow us to achieve our food security goals, right? All of these areas are impacted. We already discussed that. Next thing is the level of environmental damage that it can lead to because of the quality of the land that gets spoiled, and it's no longer amenable for cultivating any more grains or any more food products that we essentially need, right? Okay, and then one of the things is in which I want to touch upon specifically is tobacco is the only product which causes harm not only to the person who's using it, but also to people around them. So let's say in a family there's a man. I'm using the example of man because I know that there are also women who use it, but I'm using a generic example of a man. If the man of the house is drinking, right, it's going to have social impacts on the family. It's going to have health impacts only on the person. But if he's smoking, there are a lot of secondhand smoke exposure that happens to people around them, including their family members, their children, and anybody who's standing. If I'm a bystander on a bus and somebody's smoking, then I'm also going to be impacted by the smoke that they're inhaling, the smoke that they're letting out, right? So a secondhand smoke exposure causes for a lot of morbid exposure to larger public. So even if, let's say, 20% of our population is smoking, 40% of our population is exposed to the smoke that they're letting. So that causes, long-term implications for health for people like that. And so this way, there are a lot of specific goals. These are major developmental goals that I wanted to highlight here. And one other goal which we wanted to look at with all of you was that we are talking about reducing inequality within the country, within major, let's say, age groups, gender groups, and all of that. And because of like how certain groups of people are more engaged in the cultivation and things like that, it is going to hamper or maintain the inequality that is still there between these various social groups in our countries. So looking at all of these, so what are we going to do? What are the things that we can take as immediate steps to handle these things? Our previous speaker, very thankful to him for covering some of these topics very succinctly, where he was able to talk about some of the practical steps that we can take up for handling these situations. So certain things which, as I said, because although now we are talking about sustainable developmental goals, some of these things have already been covered even from 2015, where they have been baby steps. And certain things like, let's say, certain curbs on not having sale of tobacco products in the school zone areas, right? So many meters within the school zone, it's not supposed to be sold. So these are all good interventions which have come in. So it's also important that we appreciate what is already there. We do more of what is good already, and we implement it everywhere across the country. That's one thing which we learn from. The next thing would be to, yes, one major way which works in India is that if you impose proper taxes on all these products, then sale of it is going to get controlled. So when people know that they're going to pay higher taxes, we see that there are different tax slabs on various products. So if these products can be taxed at a higher level, right, then it becomes a premium product, and then automatically, of course, it is not a choice that the person is making, but at least it is not as offhand, like just like I go and buy a biscuit packet, I go and buy a cigarette. I don't do that anymore, right? So that's one thing that we can think of. And certain restrictions, like Dr. Rajdeep was saying, like, restrictions on how much you can procure. And that comes not just from the person. There is some larger monitoring where, beyond this level, if we can do it with how much money we can withdraw from the bank every month, we can also do it for sale of tobacco. So how much more can I purchase this month? Not beyond this. And while we understand that if it is an illness, so they know that if beyond this, I have a lot of craving for the tobacco and I cannot do without it, then within the public health system, within, let's say, the primary health center level, for people to see that, okay, they are struggling with tobacco related addiction. So let them go and seek help at the right place at the right time. That way, quality of life for that individual also improves and can bring them back to their maximum level of productivity that was there earlier, prior to when they got into addiction and things like that. So these kind of interventions are some things that we should we can consider as a nation, right? And at the same time, because when it comes to self-help also, when people it's also possible that a lot of youth, because of awareness, while they are exposed to a lot of let's say fancy things in the media, I would also like to appreciate them for the level of, because they have access to all this information. So if we can put all this information in more publicly accessible places, like if we can share photographs on Instagram, we can also share some, let's say, quick reading material on Instagram and platforms where our youth are actually accessible. So if we keep it as a booklet, they're not going to read it. So let's go where they are, put it in a form, a very short form, which they will quickly read and get some information. And we let them self-reflect on these things in the areas where they are. So I think I'll keep the rest of it for discussion because it's going to be a quite long day and we have one more speaker. So if these are just the major areas I wanted to discuss apart from what has already been discussed today. So yeah, I would thank everybody for this opportunity, and I can see that we're talking to a large group of youth, which itself is a very important place, because if every person here speaks to 5 other people about it, so maybe you're not going to sermonize them about it, but if you share that, okay, this is what I heard, what do you think? If you can discuss these things in your forums, in your groups, then we can set a large group of people thinking about it, right? And if there is even 1 or 2 people who actually need help, goes to a help-seeking source, then that would be, I would say, a success from the various talks that all of us are giving to. So thank you so much for this opportunity. And I'm open for any questions on the chat box or later if somebody wants to contact personally about it. Thank you.